If you are frustrated with hair loss, Utah Facial Plastics has so many hair restoration options available. I'm with Dr. Henstrom and our patient Abe, and you're actually doing a procedure on Abe right now. Dr. Henstrom, what is this?
We're injecting a combination of PRP, which is platelet-rich plasma from Abe's own blood, mixed with a product called ACell. And we're injecting this around the hair follicles that are miniature. These are the hair follicles that we're starting to lose early in the process, and ones that we think we can stimulate to grow back and get some more hair.
So PRP, I've heard several times. What does that do? What does the platelet-rich plasma do to stimulate that growth?
It brings in and it stimulates products that can help tissue grow and help tissue heal. And it's enhanced by the product that we mix it with called ACell, which does the same thing on a higher scale. It's been used for tissue regeneration for a number of years, and we're learning now that it can be very useful in hair regeneration as well. So we're starting to use it in our hair regeneration patients with injections with PRP.
So are you just going around the crown, or how do you know where to inject?
So every patient's different, but for him, we have areas where we've got thinning up front in the hairline that we want to thicken, and this is where we want to thicken. We want to bring in a little bit here in this temporal recession area, again where we see it's thinning out. Feel that in, and then he does have some balding onto the crown on the top of his head, which we're also going to inject and stimulate.
Abe, have you noticed all of this and been frustrated by it?
Yeah, in my 20s, he called it up front. I just called them my power alleys up front. But in my 20s, we lost that pretty quick, and no big deal. I didn't think much about it until I was in an elevator, on vacation a couple months ago, and saw the mirror on the ceiling and thought, oh my gosh, what's all the rest of that losing on the top? So yeah, a little frustrating. Didn't know it was there.
So while you're talking, you're getting injections. How's it going so far? You're pretty calm, Abe.
I can't feel anything.
Really?
Yeah, it's perfect.
Yeah, so we've done a block around his entire head with some numbing medication, so it numbs up the scalp. So he's really comfortable the entire time.
So
other than when we had to do that.
How long will this take to see results, and how long do those results last?
So it can come back. We can see results as early as 2 months, which is quicker than with any other injection therapy that we've had for hair at this point in time. So maybe as early as 2 months. We tell patients, be patient, and maybe 3 or 4 months. We'll start to see some improvements, but we wait a full year to really determine, okay, how effective was this? How much did this work for a patient? We want to see that hair cycle through all the way through for that year.
All right, so how do you know, if you're out there watching, if you are a candidate, a good candidate?
Well, a good candidate is going to be one that has some hair follicles left. Thinning patients, completely bald patients that may not be as effective on, but patients that are thinning in these areas specifically, that's very useful. And then, Abe's a great candidate because with dark and curly hair, we get growth back in that, and it hides the scalp really well, which shows even a better result.
And Dr. Henstrom, men and women can do this procedure?
Yep, it's just as useful for men and women. We, of course, do a lot more men, as you might imagine, but there's plenty of females out there with balding pattern and hair loss, and it bothers them just as much when it happens to
Abe,
them.
I can't wait to see what this looks like. So far, so good?
It's not bad.
Not bad.
Not
if
terrible.
you would like to try this procedure, make sure you go to UtahFacialPlastics.com. They also have a phone number right there on your screen. Let them know you saw this segment for $600 off the procedure. Dr. Henstrom, Dr. Thompson, both absolutely amazing. You're in good hands. Yep. Wet that down and keep going, Dr.
That's right.
Henstrom.